Hello students, we will discuss again a common condition, infective condition, which we come across in surgical OP and ward very commonly. Just see what this condition is. Look at that. There is edema in the fingers, dorsum we should examine, and there is redness here, and palpation may be very tender, excruciating pain, and induration may be there, and patient may be having fever, tender axial lymph node may be palpable, movement may be restricted, finger movement may be restricted. So very typical disease, hand infection, palmar aspect could be mid-palmar space infection. But we got palmar spaces, thenar space and mid-palmar space. Mid-palmar space runs in the lateral aspect of the margin of the middle finger, like this, like this, like this. Thenar space is like this, thenar space is like this, mid-palmar space is like this. So probably it is the mid-palmar space infection, hand infection, very difficult, very deep actually. Most of the time it is deep, there is a point you have to remember. And features are severe, already told, pain, excruciating pain, redness, severe tenderness, frog hand in the dorsum, you have to examine dorsum of the hand, restricted finger movement, tender axillary lymph nodes, and do ultrasound, you can see the collection, X-ray to see what is happening to the bone, and blood counts, total count will be increased, C-reactive protein may be raised, diabetic is very common, so RBS, blood sugar has to be estimated, and now treatment is start antibiotic, then drain the abscess, either under general anesthesia or regional anesthesia, the brachial block. Local won't help, wrist block may be possible, but usually they will give brachial block also possibly, which is also fair enough. And make incision, adequate incision, deep incision, never cross the crease line. Crease line should not be crossed. Always open the vest space. If this is the abscess area, put an incision like this and open the vest space also, because there will be focus in the vest space also. Always go deep, open the palmar aponeurosis and open deeply, then drain it. If you make only superficial incision, your drainage will be inadequate, it will be failure. So deep incision, adequate incision, opening the vest space is very important. Never cross the crease line. These are the points which you have to always remember. Collect the pus for culture sensitivity and put a very good wash and pack it and put a dressing, and then keep the position of the rest and position of the function. Initially position of the rest, then eventually position of the function. Once the patient comes out of the pain and sepsis, immediately we have to start the physiotherapy for the fingers. Otherwise, finger stiffness will occur and they'll get the restricted mobility. So to avoid a complication, early physiotherapy, once the infection comes down, pain reduces. So that is also important. So complications are osteomyelitis of the metatarsals. Hand stiffness is very, very common. Proper physiotherapy is required. Some arthritis can occur, it's very, very difficult to manage. And sepsis and infection spread, especially in diabetic and immunosuppressor individuals or those who are on steroids. So hand infection is a very common asked main question. Different types are there, suppurative tenosynovitis, then Canavel sign, then apical space infection, all those different web space infection, the mid-palmar space infection, thenar space infection, all these infections can be as a short note for you. Basic surgical anatomy of the hand is very, very important to understand the principles of managing the hand infection. Mainly elevation of the lip, proper antibiotic elevation, adequate drainage, early physiotherapy, and the prevention of the complications are the basic principles while managing hand infection. You can always go through my clinical methods to understand how to examine hand and how to manage hand infection, my manual, and technical aspect, my operative surgery, and begin our lectures through JP Publisher with detail about everything about the hand infection. So students, I hope basics about hand infections you understood very well. Thank you very much.